This brief video examines the dangerous complication associated with hernias, which is strangulation, by way of a simple line drawing. So let's look at this drawing over here. On this side are the loops of bowel. This is the abdominal wall in its cut section, and you can clearly see a defect in the abdominal wall allowing a loop of bowel to traverse that and then come back inside. This is the skin, and this is the subcutaneous tissue, which is generally fat. So let's see, why does strangulation happen and what does it mean? Strangulation simply means that the blood supply to an area has been cut off. And how does it happen? How does it happen? Typically, bowel travels into the hernial sac through the neck, which is the most dangerous part, i.e. that is the narrowest part through which the bowel has traversed into the sac, and if it tightens it will cut off the blood supply and the trapped bowel will be dead and become necrotic. That is a life-threatening complication. Now, moving on to the symptoms, typically patients feel pain, but this time this pain is quite different to the kind of dragging pain that they may be used to. So the hernia becomes very painful, it may get bigger in size, and it may be accompanied by other abdominal symptoms such as generalized abdominal pain, vomiting, and nausea. Now, if there is bowel perforation, then the abdominal symptoms could be a lot worse, and patients may have constitutional symptoms such as low blood pressure and a high pulse rate. Now, hernias become irreducible. What does that mean? For most patients, hernias can go in and out, so when they are lying down in bed at night, the hernias disappear back inside and the area looks quite flat. When strangulation happens, then the bowel or the contents are trapped and no longer travel back inside. And in late cases, the skin overlying the hernia may become quite red and inflamed. So if these symptoms arise, please seek early medical help by going to the nearest hospital. The patient would require urgent surgery to rid them of this dreaded complication.